The individualized approach is always best because every individual is different, right? How they heal, how quickly they can build muscle strength back, how quickly they can get their cardiovascular fitness back. That's different for each person. Um, and there's often this expectation that they'll be just like someone else. And unfortunately, you see in the news, some pro athlete who gets back 3 months post-operatively, and so there's this expectation, well, surely I can do it at 4 months or 6 months then, when maybe what's healthiest for that person is 9 months to a year. And they just don't understand that. And they think, well, other people are doing it. And so, yes, there's a constant comparison happening. In sport anyway, they're constantly comparing. And then you've got injuries and everyone can respond to them differently. And so then that's being compared. And even what's done by the surgeon can be different. So then that changes how the outcomes can be and how quickly people can recover. But they don't understand that or know that or have the knowledge that's necessary to know why that's different. And so everything, just sort of like a knee injury that needs surgery, is all lumped together, even though they're vastly different depending on what the surgery is and the technique that's used to do it and the surgeon who does it, and their protocols. And all of those things are variables that athletes don't understand. They just see one thing. And so I think that's important to understand better before going through the process. So in that prehab phase, that's part of the education, so that they can just have a better awareness of the fact that it still could be okay. Because if they don't, then the mental side of things can spiral quickly. And if they're not doing well with that mental confidence piece or self-esteem piece, which are so closely linked, they can have awful outcomes, even if the physical strength is there and the stability and function of the knee is back. So you really can see differences between how people return to sport. And I've worked with rugby players, which is a tough sport with tackling, and you've got to be brave when you're out there. It's not an easy sport, and people get injured easily. And ones that are able to sort of deal with that mental side well and really sort of take it on and perform really well. And those who will not stop talking about how their knee feels different. They just can't get over that. And so unless they're taught how to think about it differently, to perceive it differently, which we can teach because we just decide how we perceive things. It's pretty amazing how much power we have in deciding what we think, right? So you can teach those things, but it needs to be taught. And so when I've worked with athletes as a physio and I see that really coming out, well, then I try to work on that part of it even more than I might with somebody else. So again, that's an individual process. So nothing is the same for any one person. And so learning and teaching that more and more is, I also think, essential to good outcomes.